Thank you for coming. We're very honored to have such a large crowd. As you know, I'm a plastic surgeon. I've been in a position a long time. I started out as a pharmacist, and going through pharmacy school at the University of Florida, I learned early on that drugs have a lot of side effects, and I was looking towards alternative treatments. So we finally, the concept and the slogan is to don't medicate, don't operate, regenerate. Regenerative medicine really brings together all the disciplines of medicine, and the future of medicine is really in this area. And we've tried to combine the different specialties together. With the different specialties, we can treat our patients all in one center. I began looking closely into stem cells about 20 years ago, 10 years ago, lecturing on body sculpting procedures with Dr. Berman in LA. We met Dr. Lee. Dr. Hee-Young Lee is the pioneer of the treatments we use, and all the equipment we use comes out of Medicon. And I'm now in partnership with Dr. Lee also. We became members of the California Stem Cell Treatment Center about 8-9 years ago. It evolved into Cell Surgical Network, and we started with 5 or 6 of us. We now have 100 affiliates internationally. Pangenics is sort of independent of CSN. This is our team. Again, thank you, David and Kenneth. Orlando's out of the country. They all specialize in different areas. So last week, David and I were on First Coast Living, and then we're trying to get the message out to everyone what we're doing in the area of stem cells. A couple of months ago, Dr. Edie was interviewed along with our researcher from Seoul, Korea. Sean M. on the left actually moved from Seoul to Jacksonville, and we established our stem cell research lab adjacent to our clinic. This is what a stem cell looks like in culture in our lab. The individual cells, this is a cluster of thousands of stem cells. They start out different shapes and forms. They're undifferentiated cells that are nucleated, and we can actually separate them in culture, so we know we have stem cells. These cells have a capability of multiplying and also producing different tissue types. So basically, a stem cell is an undifferentiated cell that's nucleated. We have millions of them in our body, more in the superficial fat. We're formed from an egg and a sperm, 2 stem cells. At birth, we have about 306 trillion stem cells in our superficial fat. And bone marrow has a very low concentration of stem cells, and there's a big difference in the different types. We'll talk about cord cells. Cord cells, unfortunately, have to be sterilized in the U.S., and that kills the cells. So usually most of the cord cells that are provided to patients have no live cells. Bone marrow has very few stem cells. They contain a good source of hematopoietic stem cells, which can regenerate red blood cells, white blood cells, and platelets. Adipose-derived stem cells is the gold standard for clinical applications. And again, 2 ounces of fat may contain 30, 40, 50 million stem cells. 2 ounces of bone marrow aspirate may only have 50,000 with 5% viability. The adipose fat-derived stem cells have 80 to 90% viability. And very simple to harvest fat. We all have, almost all of us have abundant supply. I'm going to go through how we take 2 ounces of fat. It takes about 10-15 minutes in the OR. We do it with local anesthesia. It's not a painful experience. It's about 36 steps. This is the Medicon system of Dr. Hee-Young Lee. And we use that system. We're evolving into a 2 or 3 step system. Instead of taking 3 hours, it only takes about 1 hour. We had the first one in the world installed in my clinic in December. So the 36 steps, the first step is the 2 ounces of fat. We have a syringe that has a weighted piston. We centrifuge at high speed. It filters the fat, and the oil rises to the top. The extraneous tumescent fluids at the bottom. We do have a little pellet we save because it has about 5 million cells. We combine the pellet with the fat, and then we actually digest the fat. And I'll show you how we do it. So this is my operating room, the 36 steps that we have to do. And so the patient comes in the OR 10 minutes, they're in the clinic around 3 or 4 hours. Collagenase, we use GMP, that's a medical grade collagenase. That is an enzyme that will digest the fat and deploy the stem cells. So I'm going to show you actually the full process of producing stem cells from fat. This is the beginning, and this is in my operating rooms. We have a licensed center, first licensed center in the state of Florida, so it's done in a safe environment. We are one of the few affiliates that do all these in a licensed center. And so we have the laboratory quality nuclear counter NC200 from this is a Norwegian company. This is the same counter that the Mayo Clinic uses in a research lab. So we can count the cells. We know how many live cells we have. This had particularly high numbers, 10 to the 7, 8 cc's. SAF stands for stromal vascular fraction. Our stem cells come from the tissues around the superficial fat cells. It's not inside of the fat cells. It's in the stroma. It's the connective tissue in the blood vessels around the fat. That's where they're sitting around waiting to go out to regenerate tissues. This is how we do it. We digest in incubator 37 degrees Celsius for an hour, and then we save the pellet and the fat, and we add the enzyme. We toss and tumble 37 degrees centigrade for an hour. So we actually save the digested fat and incubate a second time. We double the number of cells. Now we're going to send the stem cells to the bottom. In a little while you'll see us pulling off the digested fat. So that's what we have after we incubate a second time, and we have to rinse the enzyme 3 times. And we also have to filter the cells because we're going to give the cells IV. We have a 100 micron filter. We actually filter 3 times. So we can administer the cells IV as well as in the spine and the joints, etc. The IV cells are very important. They seed the entire body. And as I told you, stem cells are undifferentiated. They multiply, and they can differentiate into all different tissue types. So that's the process. This is one of the first stem cell procedures we performed. Then we take the cells, we inject the joints as well as IV. It's a little different. We also take PRP, platelet-rich plasma. PRP is 2 ounces of blood. We'll spin it down to anywhere from 8 to, we can get up to 16 cc's, but usually about 8 cc's. So we have the Magellan arteriocyte system. Like the stem cell processing system from Medicon, it's totally enclosed, it's totally sterile. A lot of disposals are expensive. We know what we have, we know it's sterile, it's totally enclosed, so we have high quality PRP. So this is the setting for this is where all of us work, Dr. Heekin, Dr. Eady, Dr. Floretti. This is the plastic surgery practice along with the Samuel Surgery Center. So it's all done in a licensed center. This is a lounge. About 6 years ago, these are 2 overnight rooms. We installed a 3D imaging, and with 3D imaging, you can actually bioprint body parts from stem cells. We did a workshop last year where we actually did bioprint a nose from, and this is some of the equipment. We have a lot more now, and I'll show you. So it's a big investment. This is a combination of 3D imaging operating rooms, and so this is where we do everything. The routine is I do staff and I produce the stem cells for Dr. Floretti, Dr. Eady, and Dr. Heekin, and they come in and use imaging for certain areas like the knees. Dr. Heekin's been in the knees, done more knees than anybody alive or in the world, and so he knows where he's injecting. He can do 15 replacements in one day. No one does that, can do that type of work in the United States, and it's a real privilege to work with him. And so anyway, this is how we do it. And then Dr. Ferretti had treated my wife for her spine years ago, and he's a great spine injector. And he's trained Dr. Eady to as a pain management doctor. And that we have specialists who's board certified in his specialty, has privileges at Memorial and other hospitals, so that's very important. We have pretty high standards. And I'm one of the few doctors, if not the only doctor, insured by the Doctors Company to do stem cells. Every year we do conduct international symposiums. Last year we had a great faculty, Dr. Gadenholm from Sweden, Dr. Lee from Korea, and Dr. Stuart Williams, Louisville. But anyway, we had a great staff there, and we did conduct a bioprinting workshop. This is a workshop here, but this is some of the things we were doing at the symposium, and we had a large crowd. This is Dr. Gadenholm from Sweden, Dr. Young Lee from Seoul, that's Sean M., and this is his Chief Operating Officer. But we had a pretty prestigious staff. So this is a nose we printed from stem cells expanded from fat. It takes about 5 to 10 million stem cells per gram of printed tissue. And you have to use a flow cytometer to separate the different types of stem cells. And this is where I started. That's what got me into stem cells, body sculpting. I helped pioneer the laser technology that does this. We still use this. It's a neat technology out of Boston, Palomar. And so from that, we went to doing this. I was asked to write a chapter in the textbook, first textbook ever published on stem cells and cosmetic procedures. And this is a stem cell facelift. And we go through the same process you saw before. And we use processed fat as a scaffold. And then we deliver the stem cells with the processed fat along with PRP. And this is what we can do with it. This is all non-surgical. And same thing with breast reconstruction. This lady had a MRSA infection, lost her tissue expander. So what we did here was use a laser to tighten this side, non-surgical lift with the laser. And we use actually a silk scaffold and 80 million stem cells in the new gummy bear implant. So we're able to recover without doing an autologous flap from her back or abdomen. And at the same time, we sculpted her abdomen and thighs with the laser. So I did it all at one time. I use stem cells in almost every aspect of my practice. We established this lab about a year ago. We have an office space next door that we renovated, and we have a clean hood. We have all the expansion devices, liquid nitrogen. We grow and expand the cells, and we freeze them. So anyway, this is how we do in the cells next door. So it's interesting. We expand the cells with a clean hood. We grow them, have incubators, and then we have slow freeze and fast freeze and store them. So, it gives us a chance to verify what we're doing. If someone will provide stem cells for you, for instance, cord cells, they're not alive, and we've taken samples, try to grow them, try to count them. There are no live cells. So here we can verify what we're doing. We actually grow the cells, expand them, and count them. Once we get this off the ground, we plan to, Dr. Heekin's going to loan me a little money, and we're going to build a new center. This is our dream center. So anyway, new techniques that we're introducing now is, hair loss. We started, it's been done for a long time. It's just too expensive to do for patients, so we held back on doing it. But there's so much demand, we're starting to do PRP for hair loss. And you can also use stem cells for hair loss. Patients having like a stem cell facelift or having stem cells injected in joints, we can inject the scalp too. We have injectors that do that. But Vici is a neat technology. We have all the most advanced lasers for resurfacing and treating the face, but this is a neat technology out of South Korea that with no downtime. Now this is what I want to share with you real quickly. We're real close to having FDA approval for the disposables. This is a system that cuts it down from this what we use now, and this is this system. The disposal should be approved, FDA approved by next month. But with this system, we can go through 2 or 3 steps in 1 hour instead of 36 steps. It'll produce a huge amount of stem cells. So that was installed in December. This is how it works. We harvest the cells, and then that goes into this device. And it has incubators in the bottom drawers. You have to toss and tumble and incubate just like the other system. But this is what saves you the time. Instead of 35 more steps and 2 more hours, it does it in 16 steps in 16 minutes. This is the micro needling. It has 36 needles that are gold plated except for the tips, and it delivers radio frequency of low laser energy into the dermis of the face. And we use PRP, sometimes we use serums to rejuvenate the face. And same thing for the scalp. And so anyway, the next piece of the puzzle in regenerative medicine, Pangenics, I'll leave for the younger generation.